Sometimes it feels like you're stuck in a world that moves too fast while you stand still. It's as if everyone around you is living their lives, but you're caught in a storm inside your own mind. This is depression. Depression is a common illness, also known as major depressive disorder or clinical depression. It affects how you feel, think, or act, making everyday activities hard to do. You might feel sad, hopeless, or lose interest in things you used to enjoy. It is not a sign of weakness. It is like a cloud covering your mind, making it hard to see the sunshine. Depression is an illness, not a choice. Many people experience depression at some point in their lives, but you may be wondering, what causes depression? Note that it is not a normal part of growing older, and it should never be taken lightly. Through neuroimaging studies, it has been found that people with depression can have physical changes in their brains. These changes can be triggered by chronic stress or traumatic life experiences. Sometimes it happens for no clear reason. Chemicals in the brain, called neurotransmitters, may also play a role in depression, as they affect mood and brain circuits. Depression could also be brought on by hormonal changes, like those during pregnancy or menopause. It can also run in families, and researchers are studying genes to understand why it happens. So, what are the risk factors for depression? Depression can start at any age, but it most often begins in the teens, 20s, or 30s, with women being diagnosed more often, possibly because they are more likely to seek treatment. Risk factors for depression include personality traits like low self-esteem, stressful events like abuse or loss, family history of mental health issues, and certain life situations. So, what are the signs of depression? You might feel tired all the time and have low energy. You might have trouble sleeping or sleep too much. Your appetite might change, leading to weight loss or gain. You might experience feelings of worthlessness or guilt. It can be challenging to concentrate, remember things, or make decisions. In some cases, people might have thoughts of death or suicide. So, why is it important to seek help? If left untreated, depression can have serious consequences. It can affect your relationships, work, and overall well-being. Some complications of depression include weight gain, substance abuse, anxiety, relationship problems, social isolation, and even suicidal thoughts or actions. It can also increase the risk of physical illnesses and early death. So how can we help prevent depression? While there's no guaranteed way to prevent depression, certain strategies can help. Managing stress, building resilience, and maintaining strong connections with family and friends can be beneficial, especially during tough times. Remember, you don't have to go through this alone. Talking to someone you trust is a good first step. This could be a friend, family member, teacher, or religious leader. Seeking professional help is important. A doctor or therapist can provide the right support and treatment. So what are the pathways to healing and hope? Therapy provides a safe space to talk about your feelings and develop coping strategies. Medication can help to balance brain chemicals and alleviate symptoms. Many people also find that turning to spiritual practices can also provide comfort and guidance. Consider exploring prayer, attending church services, or engaging with a supportive faith community. These practices may help you find a sense of peace, connection, and strength. Lifestyle changes are also important. Engage in activities you used to enjoy even if it feels difficult at first. Prioritize getting enough sleep, eating nutritious food, and exercising regularly. Remember, recovery is possible. With the right support, you can overcome depression and rediscover your joy. If you or someone you know is struggling with thoughts of suicide or self-harm, take these steps. Contact a doctor or mental health professional for immediate help. In the US, you can call or text 988 for the Suicide and Crisis Lifeline. They are available 24/7. Veterans can press 1 for the Veterans Crisis Line. If you need Spanish support, call 1-888-628-9454. If someone is in immediate danger, stay with them if it is safe to do so, and call 911 for the nearest emergency room. Even if you're not personally struggling with depression, chances are someone you know is. So understanding how to support while also prioritizing your own well-being is just as important. Understanding how to support a loved one who is struggling with depression is crucial. It can make a significant difference in their journey toward healing. Start by educating yourself about depression. Knowing the facts can help you empathize and offer informed support. Encourage them to seek professional help and reassure them that it's okay to ask for help. Be patient and listen without judgment. Sometimes, just being there and showing that you care can be incredibly comforting. Offer to accompany them to appointments or help with daily tasks that might feel overwhelming. Small gestures like sending a thoughtful message or inviting them for a walk can provide much-needed connection. Remember, it's also important to take care of yourself. Supporting someone with depression can be challenging, and maintaining your own mental and emotional health will enable you to be a more effective support system. Consider talking to a counselor or joining a support group for caregivers. Together, you can create a network of strength and understanding. By offering your unwavering support, you can help your loved one feel less alone and more hopeful about their future. Remember, you're not alone, help is out there, and healing is possible. Whether you're dealing with depression yourself or supporting someone who is, knowledge and compassion make all the difference. If you found this video helpful, consider subscribing for more health tips and important conversations. Take care, and I'll see you in the next one.